Welcome to More Than a Therapy Couch, the podcast where we go beyond the walls of traditional therapy sessions. I'm your host, Tiana. In a world that's constantly changing, so are the ways we navigate our mental and emotional health. We're here to embrace the notion that healing and growth extend far beyond the walls of a therapy room. Throughout this podcast, we'll be joined by a diverse array of experts and everyday individuals with compelling stories to help bring awareness to whatever you may be facing. We'll unpack the complexities of the human experience, tackle taboo topics, and challenge the stigmas surrounding mental health. So grab your emotional support water bottle, find a comfy spot, and join us as we embark on a journey that goes more than a therapy couch. Let the session begin. As a reminder, the topics discussed are for educational purposes only and are not meant to be taken as clinical advice. If you are concerned about you or a loved one's mental health, consult a mental health professional or call SAMHSA's 24-hour hotline at 1-800-662-HELP. Welcome back to More Than a Therapy Couch. Today we're talking about a huge milestone for many new moms or new parents, and that's returning back to work. During this time, it's filled with mixed emotions, stress, and sometimes guilt, but it's also an opportunity for growth and setting boundaries. To help us unpack this topic, we have Shaina Davis with us today. She's a licensed therapist with experience in maternal mental health, life transitions, and so much more. Shaina, welcome to the show.
Thank you guys for having me.
Shaina, why don't you tell the viewers a little bit about yourself and a little bit about your experience in the mental health field?
Sure. So I am a licensed clinical social worker and a licensed clinical drug and alcohol counselor. I graduated from Rutgers School of Social Work in 2017. I had some experience working with substance use and I was doing IOPs, higher level of care, and then I found myself in private practice, and here I am in Tree of Life almost for 4 years.
And what's your favorite thing about being a counselor?
I think one of my favorite things about being a counselor is being able to help people in their journey in the sense of their healing journey. And obviously because healing is just not linear by any means. So you get to see a lot of people's up and downs. But I think the end goal is always what's so beautiful about therapy. And I think that looks different for everyone.
Absolutely. I think a lot of people, especially if you've never been to therapy, they're like, okay, I'm going to try therapy and I'm going to go for 5 sessions, 10 sessions, and I'm going to be fixed.
Right.
And I'm going to feel great. And after every single therapy session, I'm going to be happy and walking out, like I'm on top of the world. But it's not always like that. Sometimes you leave therapy and you're like, damn, that really sucked.
Yeah. Where people think we have a magic wand. And I'm like, no, that's not how this works.
Well, why can't you fix this for me?
Right.
Mm-hmm. And I think a therapist's job is to hold up the mirror and kind of reflect back everything that you're saying in session. So you may be saying one thing or wanting to work on one thing, and the therapist's job is to guide you through that or challenge you. Okay, you're doing this, so why do you think you do that?
Right. Exactly.
During this time, there's a lot of people that are transitioning back to work where it can be you took maybe a leave of absence for mental health reasons. Maybe, you were on maternity leave. There's a lot of different reasons where you may be taking a break and returning back to work. But specifically with maternity leave and returning back to work, what are some of the most common emotions or mental health challenges that new moms or new parents experience when they do go back to work? And you could talk about this from a personal standpoint as well as from your clinical standpoint.
Yeah, of course. So I think in general, a big feeling that a lot of people feel when they're returning back to work, whether it's mom or even new dads too, is just this huge feeling of guilt. Like, oh my God, I'm leaving my kid. And obviously that looks different for everyone in terms of childcare, right? Do they have to start going to daycare or do they, have a babysitter, a nanny, or, their parents that are able to help them out. But, you still feel this immense feeling of oh my God, my baby's so young and I have to go back to work. What is that going to look like? So just this feeling of guilt is so hard to deal with. And I think, obviously from a personal standpoint, I remember feeling oh my God, how am I going to do this? I'm just going to leave my baby for 8 hours a day. And it's a big thing to work through. And I think along with guilt, it's just feelings of sadness, fear, and trying to figure out what is life going to look like in this balance of like the expectation of like having to try and do everything. So I think those are probably the biggest feelings a lot of people experience, and just trying to figure out that transition of like, what is my new identity too, right? Of trying to balance like, okay, mom, dad, but also still like, do I have a career, right? Like, and how am I going to do all of this at the same time?
And exactly, depending on you, everyone's different, but especially if you're a new mom and you also have a partner, you still want to keep dating your, your partner, and you still want to be making sure that you're exploring that and making sure you're balancing your time equally. And it definitely seems like there's like a cultural pressure for moms to do it all. And how does that kind of like impact your mental health? And how does that kind of impact clients' mental health? I know we kind of touched on that, but specifically like mentally, how does that kind of weigh on someone?
It's a lot. I think it's something that can be really heavy, and I think it is something that can definitely impact one's mental health. I think just like the feelings of guilt and trying to do it all, like this society's expectation of like, you're supposed to go to work, you're supposed to sleep 8 hours a day, you're supposed to meal prep, go to the gym, balance your like relationship, your partnership, whatever it is, right? But like also still be present for your kid. And it's like, there's only 24 hours in a day and it's never enough. Or something's always lacking too, right? Because, I mean, even personally, I feel like sleep is the first thing to go, right? It's like, oh, I got to stay up late or wake up early, or I don't work out, right? Where that was like something that was really important for me and like my mental health personally, right? And I think that's something a lot of my clients experience too, of, okay, we're supposed to be prioritizing self-care because obviously we can't fill an empty cup, right? And we have to be able to have a full cup for our kids, right? And be the best versions of ourselves. But it's hard when there's not enough time in the day to prioritize self-care sometimes. And I think that's a big thing I see even with my clients of like, okay, but I don't have time, Shaina. So like, what do I do? I'm like, yeah, I understand. But it's like, even if it's 5 minutes, and I think it's just also adjusting your expectations of like, what does self-care look like? Realizing it's a season that we're in, right? Like this isn't going to last forever. Your kid goes through different stages, different ages, and it's always going to look different. And I also believe like every stage is hard in its own way, right? Like newborn, they say, is so hard because you don't sleep and X, Y, and Z. Obviously, when you transition back to work, it's like, I have to sleep. I have to be on at work. So it's like that whole stage. And then toddler is like a whole different stage of hard, right? So it's all hard, but it's all different.
And then finding what works best for you. So everyone's different. The same thing that you were just saying. So some people's self-care may be, okay, well, I'm going to sit in my car for 10 minutes before I go into the house and, see my kid or kids. It could be waking up a little bit earlier and going for a walk and having that time for yourself. It can literally be as simple as treating yourself to coffee in the morning and being like, okay, I got this. Like, we're going to have a great day. But yeah, so we're going to explore what self-care looks like, things that you can kind of implement on your day-to-day basis right after this sponsored break. Today's episode is brought to you by Tree of Life Counseling Center, where people come to heal, deal, and learn to thrive. They currently have immediate availability for talk therapy and medication management with a team of over 50 licensed clinicians. Are you feeling alone? We all can use someone to talk to. Call 732-393-8391 or visit us at www.treeoflifecc.org to start your journey of self-discovery and healing today. And we're back. So for the moms who are listening or parents who are listening who feel overwhelmed, what are some practical strategies that they can use to manage their mental health while balancing work and parenthood?
This is a loaded question, Tiana. So I think a lot of, practical strategies, like just going back to what I was saying earlier, is trying to start really small, because I think the expectation of like, okay, I'm going to go back into my old routine of pre-baby and pre-kid can be really overwhelming in itself. And then there comes along the whole feeling of failure, because a lot of the times we're not going to be able to meet that expectation or that same routine anymore. So I think, something that I always suggest is start small. even if it's like the finding 5 minutes, if someone's having difficulty, right, of enjoying your coffee, set your alarm, try and sit down and do that by yourself so you have me time, or go for a walk, set 20 minutes aside. If you used to go to the gym and work out for an hour, start with 20 minutes. Just trying to balance, like starting small, I think is super helpful in terms of people's expectations, because then it kind of can stray away from like those feelings of failure or disappointment, which then add on to the rest of the emotions that, you know, new moms and new dads are already feeling, that we just don't need, because it's too many feelings to balance.
It's a lot all at once.
So I think that is really a good suggestion. I also think trying to just navigate some mindfulness too, of like whether that's deep breathing or journaling, of just trying to stay grounded in like where you're at, because I think we can really get caught up in trying to think about the future of like, okay, I have to do all of this, and you're trying to plan, and it's too much all at once. And so trying to stay grounded with, okay, I'm here for today. Tomorrow's going to look different, right? So doing some mindfulness techniques is very helpful.
I think too, just even if you're not a parent and you're listening to this episode, if you want to make a change in your life or a change in your routine, starting small is the way to go. Mm-hmm. I think just with anyone, if you decide you want to work out, you know, more, you decide you want to eat healthier, no one's saying you can't have an off day or you can't have a sweet treat. You can still do those things, but it's all about having balance and being mindful when doing all of these things. You don't want to keep doing, okay, well, I'm, you know, cooking for my family and I'm taking care of my kid and I'm bringing my kid to the doctor. When was the last time you made a doctor's appointment for yourself? Thinking of things kind of like that and seeing what you can do for you specifically. One of the other things that I wanted to ask you, you know, parents can sometimes, we talked about guilt. So parents sometimes can feel guilty about even asking for help. What would you suggest that they do to overcome that guilt, and why is building a support system during this time so important?
So I think that building a support system is so important because, I mean, everyone, I'm sure he knows the saying of like, it takes a village, right? And it does. But the reality is too, not everyone has a village, right? That they have access to ask for help or even comfortable asking for help. Because like you mentioned, not everyone's comfortable doing that, you know, whether it's surrounding pride or also like cultural expectations of like, I should be able to do this by myself with no help, which is just not true. And it's not realistic because it's a lot. And there's a lot of moving parts, especially when you do go back to work. So that support system is really important to build, but it's going to look different for everyone, right? Not everyone has grandparents that are accessible or that are around or that are willing, right? So, you know, your support system can be friends. It can be the daycare that you send your child to, right? It could be anyone that you are comfortable with, but getting comfortable is the hard part, right? And I think it's just being able to do a lot of work surrounding that acceptance piece of like, I don't have to do this by myself, instead of the thinking part of, okay, this is what's expected of me. Like I should be able to, but you don't have to. And I should be able to also, like, I think society needs to really get away from, because it's just not realistic. We're all only one person, and every kid's also very different and has different needs. More highly sensitive kids may take a lot more attention or, you know, kind of requirements. So again, it like everyone's situation looks different. So I think it's always just being able to kind of assess where you're at. And there's a lot of acceptance work that comes behind when you're a new parent of, okay, it's okay to ask for help, or it's okay that I don't get it all done. But that part is like a lot of inner work and stuff that it takes some time to adjust to, for sure.
I'm actually going to take a little detour. I don't know if you saw on TikTok, but there was a parent, I believe she had 2 or 3 kids, but she, I guess, was posting on TikTok about her taking care of her kids. And she mentioned that there was 17 diapers in her bedroom or in her living room that were dirty. And everyone started judging her. But then there were other creators who started making more TikToks that literally said, Well, wait a second. There's 17 dirty diapers, meaning that her kids are still being taken care of. It's not like she's leaving her baby in dirty diapers and she's not changing them. But her husband was away. He went on a work trip. She was 3 days postpartum. Love to know your thoughts from a clinical standpoint.
I think a lot of people can be judgmental when they're also not in that position, right? I think it's very easy for outsiders to have an opinion, and it's like, you're not walking in my shoes, especially 3 days postpartum. Okay. Unless you can relate, I think, you can only imagine, but it's never the same.
Exactly.
And you know what? I also think that there's people that will still judge regardless. And that's also, I think, a whole nother aspect of, new motherhood, new parenthood in general, of like the comparison game. And that is really hard, because if you fall into that whole loophole and spiral of comparing yourself to other moms and other parents and other kids, it's just, that's a whole nother mental aspect of decline, I think, for a lot of people. So in regards to that mom, I think, she's probably doing the best that she can with her circumstances, and considering being 3 days postpartum, I think people need to be a little kinder. Her kids being taken care of. Sure, there's dirty diapers on the ground. Okay.
But her kids are being taken care of, which is the most important.
Exactly. And she may be having a hard time. And I think that's where it comes in, postpartum anxiety, postpartum depression, all of the postpartum psychosis, right? All of these things that there's a stigma surrounding, and women are afraid to get help for, because they're afraid of being judged. And this is why. So I think a big part of what needs to shift in our society is society's expectations of what is okay and what's not.
And I'm sure, as you said, people will always judge, but I'm sure that if she had a nanny with her 3 days postpartum, oh, well, you just had a baby and you have someone else taking care of your kids. Like you said, you're doing the best that you can. Her kids are safe. Her kids are being taken care of. That's all that matters. She's not neglecting her children, right? And she's also, like, when you're postpartum and you're also like 3 days postpartum, you're like physically going through a lot of stuff on top of the mental aspect of, oh, okay, well, now I need to make sure, your baby's every 3-4 hours sometimes they're waking up. That's a lot mentally, and then also physically being that many days postpartum.
Right.
So segueing off that a bit, a lot of parents or new parents may feel kind of torn between advancing in their careers while also being present at home. How can they navigate these competing priorities without feeling like they're failing at one or giving one more attention than the other?
So I think a big part of trying to feel like you're balancing both is, setting boundaries. Right. I think especially with work, because at the end of the day, you're always going to be replaceable at work, or, there are always other jobs out there. However, you're not replaceable at home. You are your kid's whole world. Right. So I think you have to remember to set boundaries surrounding like work-life balance, because that can always change. You can always advance. You can always start over, but your kid only has one childhood. So I think really having that into your perspective is important. And look, everyone's priorities are different. There are some adults out there or parents that really want to focus on their career, and there's also nothing wrong with that. But just making sure you're comfortable also with whatever it looks like for you individually, because again, that looks different for everyone. But I think just having boundaries in all areas is really important, and realistic boundaries, because sometimes we can set boundaries that are unrealistic. And then again, comes into the whole place of fear of failure of like, or this isn't working. Right. And then it's like, this is pointless. So I think when we set realistic boundaries, again, depending on what that looks like for each family, is really important.
Absolutely. I think a lot of parents, they are just doing the best that they can. And I think as generations are getting older, I think a lot more people are becoming more aware of their mental health and how that affects children, how that will affect their future families kind of growing up. And I think what you're doing right now is also, this is something I was looking into recently, is you are becoming your child's like inner voice. And I think that's something that's really, really huge that a lot of parents don't realize, that like if your shift isn't on necessarily your family, now we said it's a balance, but at some point giving your child that undivided attention, I think is really important, because they may not be able to get that anywhere else. You don't always get that in school. You don't always get that with friends. But at the end of the day, your safe space should be your parents, should be your family. And sometimes it's not, but that's why we're here when we're talking about it.
Right. And this is why a lot of people do come to therapy, right? Because, family dynamics can be super complex. But the goal is to obviously always be as present, I think, as you can. And obviously, that looks different for everyone. And even with the best of intentions, sometimes I think from parents not even realizing that can shift along the way or along a child's lifespan, unfortunately. But, primarily, it really should be the main goal of prioritizing your family, because that's the base of it all.
You definitely put something in perspective for me now. For the listeners, I do not have a partner. I do not have kids. I'm not planning on having kids anytime soon, but I do think a lot about the future and what my future family will look like. And I think that's something that's huge. And I loved how you word it. You can always be replaceable in any job, any work field, but you will never be able to be replaced as a parent. But I don't think you're ever going to have that same type of connection that you would if you didn't do that. So leading into workplace and how your job can very much affect your mental health, how you are as a parent, what do you think workplaces can do to support new moms or new parents? And what advice do you have for new parents who want to advocate for their mental health, specifically at work?
So I think what would be really helpful from a workplace standpoint is just being flexible and understanding. I think there's this fear when people go back to work of like, I have to go back and this is what's expected of me, or, I'm going back to working like these 40+ hour work weeks and all of that. And obviously that can be very daunting to a new mom when it's like, okay, but my baby's at home, right? So I think that flexibility and understanding goes a long way. And just like empathy too of new moms or new parents of, again, this is just a season. It's not going to look like this forever for these people, So I think being met with that is really helpful. And I also think that obviously as long as people are not taking advantage, because there's always that side of things too, that's how people can balance it with their job, and their job can balance it with their employees as well.
And I think something huge that we've spoken about, advocating for yourself. No one knows what you're going through unless you are willing and open to speaking to someone about it. Now, I'm not saying your job needs to know every little nitty gritty detail that's going on in your life, but you can be like, listen, this is where my head's kind of at. This is where, I'm looking for some more guidance. Can you work with that? Or what can you kind of do to help make things a little bit easier for me? No one's going to know that you're struggling unless you ask for help. And again, going back to what we were saying before, don't be afraid for that. If your support system has to be some of the people at work, that's okay too.
Right, exactly. And just being open to that, I think at the end of the day is such a relief. It's just getting to that point of being comfortable, because I think once people get to the point of like feeling comfortable asking for help, and then they're met with like kindness and they're taken back, it's like, oh, I can breathe. Like I have a little more breathing room, right? So it's just being able to get there. And again, I think it's a work in progress for a lot of people, and that's okay. It's, not everyone's comfortable asking for help due to many different reasons. And it's all good. It's just you have to also challenge yourself a little bit, because otherwise then nothing's going to change and you get stuck, and that's an even worse feeling.
Absolutely. I think a lot of people too, they're very quick to take off of work if they are sick. They have a cold, they have a fever. They're very quick to do that. But if it's them mentally being drained, it's, oh, I'm going to power through and I'm going to power through. And what did you say earlier? You can't give from an empty cup. So what are kind of your thoughts on like mental health days? I know that's something that wasn't really talked about probably 10 years ago or maybe even 5 years ago, but I think it's something that's very prevalent right now. And I think it's something that a lot of people can use to their benefit. And again, not being afraid to ask for that.
I'm all for mental health days. I think they're so crucial for everyone, new motherhood, new parenthood or not. I think just in general, mental health days should absolutely be allowed. It's, people have, people that do have paid time off. I understand not every job offers that, but when you do, you should be able to take it for whether it's vacation, a sick day, a mental health day, it doesn't matter. People should be able to utilize it the way they need it, because everyone sometimes gets burnt out, and, without being able to take the day, without also feeling this immense amount of guilt or like, I'm going to get in trouble because I shouldn't be doing this, then it just becomes this ongoing cycle of, okay, I got to keep pushing through. I got to keep pushing through. And then that just leads to worse problems. Like that could lead to people then taking a really long leave because more mental health issues may arise. So I think when people are offered flexibility and able to take mental health days, I think it can be super preventative too.
I love that. I think people don't realize how quickly they can spiral. And that's with anything, with like depression, anxiety, postpartum, like with anything in life. As soon as you recognize you're having that feeling, kind of being like, all right, well, why am I feeling like this? Or what has my day-to-day been like? What has it been consisted of? And just giving yourself grace. This is, for a lot of people, you're a new parent. Maybe for you, you didn't grow up with both of your parents present. Maybe you didn't grow up in the best in-home environment. As long as you're doing the best that you can, that's all anyone can ask for. And I think if you recognize that you're doing certain things that you're not the happiest with, educating yourself, getting yourself into therapy, I think a lot of parents don't realize the power of them being in therapy and how that will benefit the whole family dynamic, as well as even their relationship with their child. What have you kind of seen in terms of how therapy has helped your clients with being like parents navigating that, especially if it's for the very first time?
I definitely think I've seen it be so beneficial in terms of trying to balance what their life looks like, and also just like the life transition and redefining their identity too. I think that's a big part of coming into therapy of, okay, what if I don't want to just be mom or dad? And I'm like, that's totally okay. You don't have to be. Like, you can still be the person that you were. It just may look a little different, right? So being able to redefine that identity, I think, is so crucial in, a new parent's mental health. And just working through those feelings of guilt that come up along the way, because it's not just surrounding work-life balance. I think it's also just personal balance too, because, when you're a new parent, you have this whole life before your kid got here. And usually it doesn't fit in the same way afterwards, right? So it's also trying to still like have parts of yourself from previous that were really important to you, whether it was like your hobbies, your workout routine or whatever it was. But obviously trying to fit that in sometimes is like a puzzle. And it's just trying to learn how to navigate that. And I think that's a really big part of therapy when they come in for transitioning after having a child. So I think it's super beneficial to have some guidance, because sometimes that's hard to navigate on your own.
And where would a new parent kind of start in terms of redefining themselves? I feel like we just talked about, there's that you can get very overwhelmed with, this is all of the things that I was before. These are all the things that I was doing before. And now I feel like I'm just going to work, coming home and taking care of my kid. Where would a new parent even begin to start figuring out, who am I now after this 9-month, almost year process, that you were going through?
So it goes back to even what we were talking about before of starting small, right? Because they say it takes moms, and like I always include the new dads too, of it can take up to 2 years to almost like start to feel like yourself, especially for women, because there's also that hormonal aspect that comes along with postpartum. So I think starting small in any aspect is a good way to start when you're trying to find like who you are as this new person, as a new mom, as a new dad, but still wanting to have some sort of other identity. So, when I work with individuals, it's like, okay, pick something you want to incorporate back into your life that was from previous kid, and it's like, let's start out 1 day a week. Can we fit that in somewhere when it's like, I feel like I'm just going to work, I'm coming home, I go straight into mom or dad mode, and then it's like, I have to go to sleep. Yeah, and I get it. All right, you got to start small. What can we fit an hour in somewhere? Can you alternate with, if you have a partner? If you don't, like, do you have, again, is that your support network? Like, what does that look like? So it's really a lot of logistics too, which I know a lot of people can struggle with, or if you're struggling with time management, right? So there's so many aspects that come into navigating new like parenthood. And that's why I think when you do go to therapy for this life transition, it can be super beneficial, because your therapist can help you kind of navigate all of those different aspects and factors that go into it.
Absolutely. So we are going to take a little sponsored break, and we will be right back. Feeling stuck mentally and physically? It may be time to supplement your self-care practices with some holistic healing options. Mind the Body Holistic Wellness in Freehold, New Jersey proudly offers a variety of healing modalities, including Reiki, massage therapy, reflexology, and Himalayan hot stone massages. For more information or to book an appointment, visit www.mindthebodyhw.com. Now back to our show. And we are back. So we have a new segment for this episode and personal story. So we have a listener, her name's Pam, and she wanted us to speak about how parents manage anxiety with leaving their baby at daycare for the very first time. What were your thoughts on it, clinical and personal?
So clinically, I think this is a very big topic, because I think a lot of people can struggle with this, and it's a huge transition when you have to do this for the first time. Honestly, I recommend you taking the day off from work, because it could be also depending on someone's personality too. I think there are some parents that are like, all right, I'm going to drop off my kid. I'm comfortable. They did a lot of research, right? And they're like, I know my kid's going to be okay. Because at the end of the day, your child is going to be okay. It's sometimes more of a personal thing, right? That you may struggle with, because again, those feelings of guilt, are they going to have a hard time transitioning, depending on how your kid is too, right? Those more highly sensitive kids, you may drop off and they may scream and cry because they're like, where am I? And then you're crying yourself, right? So I think it depends on someone's personality, but I also think being able, just in general, when you have to manage your anxiety about that, I think a big piece is like, take the day off from work, right? Like being able to manage that, so that way you're not worrying about like, okay, I have to rush to work. I'm a ball of anxiety. Or if you're crying, just having a hard time, it's like you can kind of just take the day, distract yourself a little bit, right? Which work may be it for some people, so that's okay too. But if you want to just be able to kind of do your own thing, I highly suggest that. Or, it's also about making sure you're picking a daycare that you are comfortable with, to the best that you will be comfortable with. Obviously, you still may experience some anxiety, but knowing that you feel like your kid is safe, I think is such an important aspect of it. Going to meet the teachers, going to see what it's all about, because you just want to feel like your kid is safe and comfortable. and just knowing it's going to be another transition. This is all about transitions. If you guys haven't picked up on
That's the theme of today's episode.
So it's like, it may be a rough couple first weeks when your child is transitioning to now this whole new routine for them, because don't forget, they also don't have the ability, like their brain is not fully developed to like understand what's going on. So
they're like, what? Mom, Dad, they're dropping me off in this place that I've never been before.
Right.
What's happening?
Like, where am I? And like also remembering too, depending on when this starts for a lot of parents, when they're real like little babies, they kind of don't know what's going on. It may be on the easier side. Then when they start getting closer to toddlerhood and when they're more self-aware, you may go through a whole nother transition already, because then they're like, no, really, where am I? Why are you dropping me off here? Right. So I think just also being able to recognize that things are always going to be changing no matter what. So being able to be kind of prepared for that to the best of your abilities, because no one can prepare you for half of this stuff. But, understanding that these things may come up even when you've already gotten settled. It's like, all right, I may have another realm of anxiety that's coming and approaching because my kid's about to go through another transition. So I think being able to just manage, like have your tools, whether that's your hobbies, the mindfulness techniques, like whatever you're doing for self-care is a big aspect of how we manage our anxiety. And also being able to like reframe your negative thoughts. I think a big aspect of cognitive behavioral therapy can be really helpful here, because we can oftentimes spiral, right, in our thoughts of what if this happens? What if this happens? And it's like, okay, we need to sometimes take a pause and remember, we're catastrophizing. This is not necessarily going to be how this looks like. So I think being able to utilize some of those skills are really important.
I think something that I also learned recently that really helps in terms of spiraling is like asking yourself, well, what are the facts? How likely is it that something's going to happen while you're at work, while you're at your kids at daycare? But again, like doing your research, and I think a lot of daycares now have this like new thing that's implemented to help parents who are struggling with anxiety. You can check in. And like you can check on your phone and see like what's going on on camera, or how many times have they changed their diaper. Their daycare is very high tech now. Yeah. And there's a lot of different things that you can see. I know like my cousin, she said when they first put their daughter in daycare, she was like, yeah, we can only go on the app like 12 times in a day. And she's like, but I dropped off my kid at 9:00 and by 10:30, I already used my 12 times. Just evaluating, and like that's okay too. You want to know that your kid is okay, and there's nothing wrong with that. But again, being open, making sure that you do your research, and just having a conversation with, I think, your child care providers. Everyone's different. Maybe for you, you don't feel comfortable with your child going to a full-on daycare, but maybe if you can afford a nanny, maybe look into that. And no one's saying that you need to have a nanny Monday through Friday, from 9 to 5. You can have a nanny for 1 or 2 days, seeing what works for you. Same thing if you have, parents that are willing to help out. They don't need to help out Monday through Friday every single day. That's a lot.
Absolutely.
Having balance and seeing maybe like easing your kid into daycare. Maybe they only go 1 or 2 times a week before implementing that. And I think that's something that's really, really important for parents. So we're just getting to the end of our episode, and there is one question that we do like to ask everyone before closing out. And if you were stuck on an island and you could bring one book with you, what book would you bring with you and why? I would like to follow up with saying, if you do not read books, if you could bring one item, I saw the look on your face. If you could bring one item, what item would you bring with you and why?
I was going to say, you guys definitely threw me for a loop here. It's been a minute since I've read a book leisurely, due to new parents.
I don't have time to read.
I've actually had the same book on my nightstand for probably 6 months now, and I think I've read maybe a total of 10 pages. So if that just puts things into perspective.
So not a book, an item.
If I had to bring one item to an island, what would I bring? Oh, this is a hard one. what would I bring? I think I would bring a journal. I think I would bring a journal. I think something I've learned for myself, and obviously in even relation to this podcast's topic, is having a place to remove your thoughts. And I'm a big believer in this professionally and personally. I think it's something that's really helpful, and I usually recommend it to all my clients, of thinking about a journal in the aspect of like, you're taking those thoughts that are in your brain that are, whether they're negative or positive, right? And just like removing them and you're putting them somewhere else. Like, I always try to make it a visual too for them of like, this is how we can get rid of negative thoughts, or we can, kind of put them in even if they're positive, like you're putting them in another place so you can look back at them, right? In a good way. So I think bringing a journal is probably what I would bring, just to have that as an option, because I think it's something that can be really beneficial as anyone's self-care. I do recognize it obviously doesn't work for everyone because coping skills are different for everyone, but that's what I would bring.
One of the things that I was recently recommended was journaling. And I feel like sometimes I'm like, I'm lazy. I don't want to write. My wrist is tired. I don't want to do that. Sometimes even too, like, I don't want to type in my notes. I don't want to do that. So I got recommended doing little video, like word vomit sessions. So I literally, like, if I feel like I need to get something off my chest, I literally will hit record and be like, blah, 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 blah. And then I'm like, okay, I think I feel better. And like the first time I did it, I was like, this is weird.
For sure.
Like, this is weird, but I think it definitely helps. And I love what you mentioned. Like, you want to get that out. So whether it's physically saying it, whether it's you writing it, and sometimes you don't always have a support person that is, available at that time. Sometimes you don't always have a friend or family that's nearby. And also sometimes you just got to let that out yourself. Sometimes you don't want to share that. And I think that's also why therapy is so important, because even if you don't want to share it with family or friends, you can share it with your therapist too.
Right. There's still another safe space.
Well, thank you so much for coming on our episode and just sharing your experience. I think a lot of new moms, new parents will definitely feel very reassured after hearing what you have to offer. And then for the listeners, don't forget, it is okay to prioritize your mental health, and you are allowed to focus on you, especially if you're a new parent. Just giving yourself some grace while you're balancing all of these new experiences, because there are books out there that say what you could do, what you should do, but you're not going to know what works best for you until you do it. And there's not a book on life that, okay, you're going to turn to this page and this is what you should do. So just give yourself grace. And we will see everyone on the next episode. Thank you so much for coming on.
Thanks for having me.
Bye.